Hey Mustangs, in this video we're going to be taking a quick look at HIV and AIDS. So to start off, HIV and AIDS are not quite the same thing. HIV is the virus that causes the disease known as AIDS. So HIV stands for Human Immunodeficiency Virus. So big long word here. So Human Immunodeficiency Virus. That's where the HIV comes from. So that's how we shorten HIV up. So that way we don't have to say that every single time we're talking about the virus. And like every virus, it has a specific host cell inside the body. So in the case of the HIV virus, the host cells, unfortunately for us, are helper T cells. So if you remember when we talked about how to activate the immune system, helper T cells are one of the cells that are necessary in order to turn on or activate your immune system. If those helper T cells are not there, you cannot turn on your immune system. So basically what happens here, when HIV gets into someone's body, it invades and infects the helper T cells, tricks them into making more viruses, and destroys the helper T cells in the process. So if someone were to get the HIV virus in their body, they go to the doctor would initially tell them that they are HIV positive. And what they look for to know how to diagnose the person, if they're HIV positive or if they have AIDS, it comes down to the number of helper T cells in their blood count. So a normal person has 500 to 1,000 helper T cells in one drop of blood. Someone who has 200 or less T cells is basically officially is declared as having AIDS. So as a person gets tested, every single time they go to the doctor, they keep testing their helper T cell count, and seeing how many there are. So they're HIV positive until they hit that point when they have 200 T cells or less in their blood cell and their count. And at that point, that is when the doctor will say, okay, you're not HIV positive anymore. Now you have AIDS. So AIDS, at that point, that means that your immune system has basically been destroyed. So when someone has AIDS, it's like they don't have an immune system anymore. They can no longer turn on their immune system because there's too many helper T cells that have been destroyed. And as a result of that, what a lot of people don't know, HIV isn't what kills them. It's some other bacteria or virus that kills them, because any other bacteria or virus that comes along now at this point can kill the person because they no longer have an immune system to basically fight off that other bacteria or virus. So if we take a look as an example here, let's say common cold. Okay, so someone with AIDS could actually die from the common cold. They can die from the flu. They can die from pneumonia. They can die from a bad infection in the skin even, because they no longer have an immune system to protect them anymore. Their immune system has been deactivated by the HIV virus. So any other bacteria virus can kill them. So in this case, here's the cold virus. So cold virus gets into the body, a macrophage comes along, it's going to destroy it, present its antigens, a helper T cell will come along and activate the rest of the immune system. But now someone who has the HIV virus in their body, their helper T cells have been destroyed. So HIV has come in and tricked the helper T cells into making more HIV viruses and destroyed them in the process. So now when the cold virus gets into the body, there's nothing there to turn on the immune system. So as a result, you can't turn on your cytotoxic T cells. You can't turn on your B cells to become the different types of where you have plasma cells and memory cells in order to protect you. So at this point, you can die from any other bacteria or virus. And that's the connection between HIV and AIDS. So HIV is the virus that causes AIDS.